A special needs car seat clinic is open to help meet requirements for children who have special needs or disabilities. Good morning, ladies and gentlemen. I'm News 8 digital anchor Luke Laster here from the Wood TV Live Desk. Joining me today is Holly Alway, Injury Prevention Coordinator with Trinity Health Muskegon, to share more on the clinic. Holly, good morning.
Good morning. Thanks for having me today.
Absolutely. So when we're talking about car seats, I don't think many people realize how specific they are per child and per their needs. Tell me about this clinic.
Sure. So the special needs car seat clinic is established for children that have issues that aren't well served by conventional seats. So I think it probably makes sense to kind of back up and talk about what we mean when we talk about conventional car seats. And those are the seats that you can go to any retail store or online vendor and purchase, just as a family, as a parent, as a grandparent. And these seats work well for most children. But there are some kids that have issues with muscle tone, with respiratory issues, with, maybe they're casted. And this is where the special medicalized car seats come into play. And that's what our clinic is able to do now, is to make sure that those kids whose needs aren't met by the conventional car seats can get the seats that they need to be safely transported in vehicles.
At what point was the decision made by you and your team that said, hey, there's a need for this and we need to take care of it?
Sure. It was in the midst of COVID, and I think all of the viewers understand what an impact COVID had on healthcare in general. And the clinic that had previously served families was no longer able to serve outpatient families. And I was getting calls on a weekly basis from families that had kids that weren't a good match for conventional car seats, and I had nothing for them. The closest place that I was able to send them was Ann Arbor, and I think it's really easy to understand that's a really big ask. If you've got a kid who's got special medical issues and they're not being transported safely, and then we're asking you to drive all the way to Ann Arbor to get an evaluation and then turn around and go back for a fit appointment once that special car seat comes in, that's a really big ask for these families. And so it was really important to us, as part of our mission here at Trinity Health, that we were doing the best that we could to serve the families and the needs that exist in our communities. And so opening the special needs car seat clinic fills that need and ensures that, for our families here in West Michigan, they don't have to travel all the way to Ann Arbor. They can stay right here in their community and get what they need to make sure their kids are safe on the road.
You had mentioned there very briefly that evaluation there all the way over in Ann Arbor. Explain the process that is those evaluations that go into fitting, those children for specific car seats.
Sure. With our families, that evaluation appointment is the first appointment that they're going to have, and we're going to look at a couple different things. And I should mention, this is a team approach. So this evaluation is done in coordination with the child's care team, so the specialists and the medical professionals that they're already seeing, along with their caregivers, their parents, and the team that we've assembled here at Trinity Health Muskegon, which includes certified child passenger safety technicians with this Safe Travel for All, which is that specialized medical car seat training, as well as physical therapists that we have cross-trained as child passenger safety technicians. So in that evaluation appointment, we're going to look at that child's history. We really want to understand, how is it that they're being transported currently? Are there small modifications or adjustments that we can make that will allow that current car seat to work for the family? Or do we really need to go to that next step and evaluate for a special medicalized seat? So we're looking at things like, what is the child's tone? Are there issues with airway? Do they need to be reclined? Can they hold a seated position, or do they need some help with that? So those are some of the physical issues. We also look at some of the behavioral considerations too. So it's not uncommon that we've been getting calls from families families who have kids that are what I like to refer to as little Houdinis, the kids that are able to unbuckle chest clips or, car seat buckles or seat belts. And so, obviously that's not safe if they're unbuckling while you're traveling down the road. So we want to make sure we're looking at all of those things. And then we can determine whether or not, maybe the current conventional seat doesn't work, but there's another seat on the market that we can do, or do we need to go and evaluate which medical seat is going to be the appropriate fit. So it's really a complex evaluation. It's got a lot of different parts to it. And we just really want to make sure that whatever we do really helps the family in the long term, make sure that the child is traveling as safely as possible.
Why is this need an important one to address and bring to light?
These are kids that are often overlooked. I mean, I think it's pretty clear when I say, the only other outpatient special needs car seat clinic here in Michigan is in Ann Arbor. We know that many children have special needs that are probably not yet being met in terms of travel safety. So it's really important for us in making sure we're serving all of the needs of our community to get these kids the opportunity to get into a seat that's going to keep them safe while they travel, and that parents have the opportunity to consult with experts who can help them figure out what it is that's going to keep their kids safe on the road and help them navigate, that process of getting the evaluation and figuring out what seat's going to work, and then getting that seat and getting it fit to the child and fit to the family's vehicle.
Run me through a timeline kind of the specifics of, you get a family who approaches you. They say, hey, we'd like to get a car seat eventually, to actually getting one in their possession.
Sure. So typically what we're going to do is a brief sort of pre-interview with the family and get a sense of what their situation is. So a couple of weeks ago, I talked with a family that had a toddler that was escaping out of the car seat. And so before we even got to that special needs evaluation, I was able to work with that family and go through some fit issues and car seat issues that fixed the issue. So the kid is now not unbuckling as the family travels down the road. So, we're really trying to make sure we're not doing more than, doing unnecessary things. So we want to keep kids in seats that make sense for that family. So if we get to the point in that pre-interview that we determine, this really does look like it's going to be a special medical seat need, or there's more going on, we're going to have them schedule an appointment. And I do want to point out that a specialist from the child's care team does need to make a referral. That's part of getting that process covered by insurance. So they need to have that specialist referral. Then we go ahead, schedule that appointment at the clinic. And we take about an hour and a half to go through, what is the current car seat? What's the child's history? What are the child's abilities? What are the issues that we're trying to address? And then we have demo car seats, medical car seats that we can use. So we were gifted with some funds from Women for Health, which is a women's giving club here at the hospital. And we were able to purchase some of those seats, because I do want to point out these medical seats are expensive. They're upwards of several $1,000s a piece. So it's not, it's not something that you're just going to have sitting around. It really does take some funding to figure out, the options that we have. So we're going to go through those options, figure out what's a good fit. And then each of these seats are tailored to that child's needs. So once we figure out the modifications that seat needs, we'll be in contact with the durable medical vendor to get that seat ordered. And then when that seat comes back, which is typically 4 to 6 weeks, we're going to call the family back in, and we're going to go through fit and installation. So we're going to help the family fit the seat to the child, make sure it does the things that we were hoping it would do in terms of keeping the child supported for travel. And then we're going to help the family install it in their vehicle. So we're doing a lot of education with the family through this whole process as well.
Specifically to you in your role as injury prevention coordinator, why is it important to provide families with services like this?
Well, I've been here for 20 years, so I've seen a lot of changes in child passenger safety in general. And the one thing that has always struck me, it's here in West Michigan, but it's also across the state and across the nation, is we still have significant misuse with car seats, not just with our special needs families, but also with our general population. So, that misuse ranges from anywhere between 70 and 90%. A lot of that is critical misuse, which means if you happen to get in a crash, the car seat's not going to do the things that it needs to do to keep the kids safe and to protect them from severe injuries or even fatalities. And so, like I said, these special needs families are already underserved in many ways, and this layer really just kind of complicates some of the issues that they're looking at. So, for these kids that are more vulnerable, we want to make sure that we're giving them every opportunity to be safe. I want these children to have the opportunity to travel. I've talked with families that before they've been able to obtain the special medical seat, that they've limited their travel. So their kids aren't getting to do the things that kids should do. They don't get to go on outings. They don't get to go to the park. They don't get to do the things that make childhood great. And so we want to make sure that all kids have those opportunities.
Holly, is there anything else that you would like to add or put out there?
I just want to point out that if anybody is interested in scheduling an appointment or learning more, they can reach out to our special needs rehab clinic at 672-6940.
Ladies and gentlemen, if you tuned in maybe halfway through this stream or just now clicking in and you're viewing on Facebook, there's a link attached. It takes you over to woodtv.com. You're able to view our full conversation right there, again, on woodtv.com. Holly, thank you.
Thank you.
Folks, this has been a look at the Wood TV Live Desk. I'm News 8 digital anchor Luke Laster. Have a great morning, a great afternoon, and we'll see you around.